today I'm going to do a head-to-toe examination. And the last time that you were here, you had some headaches. Is that correct?
Yeah.
Okay. Can you please verify your first and last name and your date of birth?
Yes, first name is IVB and last name ASMR.
Okay.
Date of birth is June 1st, 1992.
Any allergies that I should have on file?
No.
Okay. And are you taking any medications?
No, not really. Sometimes I take some multivitamins. That's it.
Sometimes?
Yeah.
Not every day?
Not very regular, no. I often forget.
Okay. And do you follow a certain diet?
I'm vegan.
Okay. So today we are going to check your vitamin B's to make sure that you're not deficient in those. Also vitamin D. And any medical history, any hypertension in the family?
No.
Okay. Any problems with your vision or your heart?
No, nothing that I can think of. I did get my eye exam recently.
Okay. And do you have any back problems? Any joint aches?
No, nothing that I can think of.
Okay. Any injuries whatsoever, like an ankle injury or?
I did sprain my ankle recently.
Okay. Which one? Left
The
or
right one.
Right. And how recent was that?
I think it was probably like a month or a month and a half ago.
Okay. And you're not having any problems right now?
No, I went to an orthopedist and he said it was mild. Gave me a brace that I should use, and I used it for a few weeks, and that's it.
Okay. So I'm definitely going to go ahead and do a check and to see how the range of motion of that ankle is. Okay. Any skin disorders? Any redness anywhere or dryness?
No.
Okay. Okay, I'm just gonna go ahead and put some gloves on and I'll take your vital signs.
Okay.
Any chest pain, any palpitations?
No. You know, I have been noticing that sometimes when I stand up really fast, I get a little bit dizzy.
Okay, that can be a sign of dehydration.
Okay.
Or low blood pressure. Sometimes when you are dehydrated, actually you can have both, so dehydration with low blood pressure.
Okay.
Drinking a cup of coffee, having just a snack, and drinking some water that could bring up your blood pressure and resolve the dehydration.
Okay.
Let's see how your blood pressure looks. Okay, so I'll put this on your arm. Okay, go ahead and relax. Your blood pressure is low, 100 over 60. Did you have breakfast this morning?
Yeah.
You did? And how many cups of water did you drink so far?
Probably not as many as I should.
Okay. Well, that could be an
Just like 3 or
explanation.
so.
We will do a checkup to see if there are any other symptoms that we could associate with the dehydration. And if it's just dehydration, then we would just ask you to drink more water and increase solids as well.
Okay.
All right. This looks good. So oxygenation is 96% in room air. Heart rate is 83. Any flu-like symptoms in the last 48 hours?
No.
Were you in contact with anybody with fever?
No.
Okay. I'll put this under your tongue. Okay, very good. 99.1. Did you have any hot tea or any hot coffee before coming in?
No.
No? Okay. Just a little bit elevated, but nothing too concerning, I would say. Okay. So blood pressure 100 over 60. And are you feeling dizzy right now?
No. Okay. Just tired.
Okay. So tired. And how many hours did you sleep last night?
Maybe like between 6 and 7.
Okay, so I would say 6.5 hours of sleep, and you do feel tired. Pulse was 83. Oxygen 96% on room air. Respiratory rate was 16. Okay. So I'm going to ask you to put this gown on,
Okay.
and I will do a full body examination.
Okay.
All right, I'll be back.
The opening should be on the front.
In the back.
In the back.
Okay, Ivy. We're going to do a lymph node checkup. We're going to start with preauricular lymph nodes. Just gently pressing down. And postauricular lymph nodes. They're just inferior to your ears. Okay, supplemental lymph nodes. Let me know if you feel any kind of tenderness or pain as I'm gently pressing down.
Okay.
Checking trachea. see if it is midline. Just gently palpating. And I'm not feeling any deviations. Also, I did not see in your history any thyroid problems or anything in your family history, which is a good sign. And you are young, so your thyroid is working strong. I'm not feeling any lumps, no nodules. Okay, you're going to feel my fingers right under your eyes. Can you go ahead and clench your jaw? Okay, relax. Okay. I'm feeling a little bit of tension on your masseter muscles, left and right, nodular. Go ahead and open your mouth and close. And again, open and slowly close. Okay. Go ahead and open again. Wide as you can. And slowly close. Okay. No deviation of the lower jaw. I'm going to put one finger in each ear. So I'm trying to feel for any popping or any sounds that could come out of the jaw, which are right here. So we're looking for any TMJ disorders. Go ahead and open your mouth again and close. Good. So I did not feel anything abnormal. Moving down your neck, checking your lymphatic veins. Okay, can you please shrug your shoulders a little bit? Okay. Just trying to see if there's anything swollen in the indentation here. Okay. I'm going going to check your facial sensation now. Can you please tell me if you feel this on the left or right?
Left. Right. Right. Left. Left. Right. Right. Left. Middle.
Okay. Now I'll touch you with a sharp object, and this is what sharp is going to feel like.
Okay.
And then I'll touch you with a dull object, and this is what dull is going to feel like. Can you please tell me if you feel sharp or dull?
Okay. Sharp. Dull. Dull. No. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 No. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay. I'm going to check the hair distribution of your eyebrows and eyelashes. So I'm going to need you to stay very still while I'm doing that. Okay, very good. I am noticing one mole on the left eyebrow.
Yeah.
It does look circular, almost actually oval, but margins are well defined. It is a little bit raised. Normal color. And I'll check your eyelashes as well. Normal hair distribution. Okay. Normal skin color on the right eyebrow. Okay. Can you please tell me if you feel cold or warm sensation?
Okay. Cold. 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 cold.
Okay, can you please tell me if this feels sharp?
Yes.
And what about now? Sharp?
I think so. Maybe the previous one was dull.
Does this feel dull?
No, sharp.
Oh, okay. What about now?
Sharp.
And now?
Sharp.
Okay. Does this feel cold or warm?
I think cold.
Okay. And is this cold or warm?
Cold.
Okay. Does this feel sharp or dull?
Dull. Dull. Sharp. Sharp.
Okay, go on and tell me if this feels dull or sharp.
Sharp. Sharp.
What about now? Is this dull or sharp?
I didn't feel anything.
Okay. And does this feel cold or warm?
Cold.
Cold or warm?
Cold.
Cold or warm?
Cold.
What about now?
Cold.
Okay, do you feel this warm or cold?
Cold.
Okay, does this feel sharp or dull?
Sharp.
Does this feel sharp or dull?
Sharp.
Okay. So I'd like to take a sample of your hair. I'm going to do a genetic testing. We're going to just collect a few samples of your scalp cells.
Okay.
going to send this to the lab. Okay, I'm just gonna go ahead and take a look at your abdomen. Is it okay if I put the gown a little bit higher? Okay. So we're just gonna go ahead and lift the gown up. Take a look at your abdomen. Have you been experiencing any abdominal pain? Okay. And so first I'll just visually examine. I'm not noticing any redness. I'll listen to your abdomen. Okay. I'm going to slowly just palpate your right side. Check for any inflammation. Okay, abdomen feels soft. I'm not sensing any tenderness. Also, liver is normal size. I was able to hear bowel sounds in all 4 quadrants, which is very normal. Normal activity. Checking your ovary size on the left side. Normal. And right side. Also normal. I'll also gently palpate and check uterus size. Okay. It doesn't seem to be enlarged. I would also like to take some measurements. And I didn't notice some moles, so I want to make sure that they're not raised. feel sharp or dull?
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull.
Okay, very good. Everything looks normal. Okay, Ivy, I'm going to check your back spine alignment. Just checking to see if there's any abnormal curvature. Skin feels soft on both sides. Not feeling anything swollen. Normal spine curvatures. Skin feels well hydrated. I'm going to check for vitamin deficiency. To check your skin darker. Normal skin return. No signs of dehydration. Or vitamin deficiency. So that's very good. Can you please tell me if this feels warm or cold?
Cold. Cold.
And does this feel sharp?
Yeah.
What about now?
Yes.
Does this feel sharp?
Yes.
Is this sharp or dull?
Dull. 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 Dull.
Mm. Going to tap in your spine to see if I'm noticing any neurological deficits. This is going to feel a little bit cold. Can you please take a deep breath in and breathe out? And again, take a deep breath in, breathe out. Again, breathe in and exhale. And again, breathe in and exhale. And again. One more time. Very good. I'm going to take some few measurements to check for any inflammation. Going to put this in your medical record. Okay, Ivy. Have you been noticing any pain on your feet or anything like that?
No.
Okay. I'll just slowly palpate, make sure that we are checking all the bones. So the metacarpals. Make sure that there is no fissure. Okay. Skin is intact. Doesn't seem to be any bone damage. And you did say that you had some issues with your right ankle, right?
Yes.
Okay. Okay. Very good mobility there. Okay. I'll check your Babinski reflex. Good. Good. Okay. Looking for any eczema.
also like to check your pedal pulses. Very good. 2 plus, strong and symmetric. No edema. Normal temperature. I'll collect a sample. Can you please tell me when you don't feel the vibration anymore?
I don't feel it.
Okay. What about now?
Yeah. Stop. Yes. Yes. Stop.
Okay, very good. And can you please tell me if this feels sharp or dull?
Stop. Sharp. Sharp. Stop. Sharp. 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 Stop. Sharp. Sharp. Stop. Dull. Sharp. Sharp. Stop.
Okay, wonderful. So everything looks very good, checks out normally. I'm gonna have you sit on the table and I will do a vision exam and make sure that your smell and your taste are normal. Okay, Ivy, I'm just going to put up a fresh pair of gloves and examine your ears. Okay, very good. Okay. Tympanic membrane is pearl gray. I'm not seeing any abnormal discharge. Any pain as I'm pulling up?
No.
Back?
No.
Down?
No.
And any pain here on the mastoid bone?
No.
Okay. I'm gonna check your other ear. Good. Tympanic membrane is also normal on this side. There's very little redness, but I would actually qualify it as normal. No abnormal discharge. And any pain as I'm pulling up, back, and down.
No.
Okay. Go ahead and keep your eyes closed and I'll whisper some words in your ears. Can you please repeat them back to me?
Okay.
Dorsal view.
Dorsal view.
Okay. Plantar labia.
Plantar.
And there was one more word.
Linear.
Yes. Okay. Okay. And now go ahead and look straight in my nose. I'll flash light in your eyes to check your pupil size. Good. any ocular pain as I'm flashing the light?
No.
Okay. So pupils are underreactive to light and accommodating. Can you go ahead and follow my finger with your eyes only? Don't move your head. Okay. And I'll check your salivary glands, your teeth, and uvula. Go ahead and give me a big ah. Any pain? No redness. Go ahead and stick your tongue out for me and move it up and down and side to side. Can you push with your tongue inside your cheek? And the other one. Okay. That looks very good. Can you please shrug your shoulders? Very good. And now go ahead and turn your head this way. Good. And now turn your head the other way. Okay. Can you please lift your eyebrows up? One more time. Very good. Can you go ahead and frown and puff your cheeks? Give them puff for me. Don't let me unpuff them. Okay, relax. Can you please close your eyes? I'm going to give you a smell to identify. Go ahead and cover one nostril and breathe in, breathe out. So no obstruction there. Do that one more time. Breathe in, breathe out. So can you first please describe the smell with one word and then identify it?
Citrusy and orange, maybe.
Okay. Go ahead and cover your other nostril now. Breathe in, breathe out to check patency. Very good. And now go ahead and give me another sniff.
It smells floral, like lavender.
Okay, excellent. And I'll give you one drop of this taste. So I need you to identify the taste for me, okay?
Cherry.
Okay. Excellent. One more.
Pineapple.
Perfect. All right. I'm also going to check your reflexes. Can you please relax your jaw? A little bit more. Okay, very good. Relax your arm for me. Good. Okay. Okay, go ahead and fully relax your arm. Perfect. Good. Good. Okay, go ahead and relax your right leg for me. Okay. Okay. Let's try that one more time here. Okay. Very good. Okay. I'm going to definitely write everything up in your chart. Make sure that we're not missing any information. And everything looks very normal and healthy. I'll have you come back in about 12 months for another checkup. But before that, I would like to check your blood levels to make sure that everything is within normal limits, especially vitamin D. A lot of people tend to have low levels, and also vitamin B's. Okay. Since you're also complaining of some tiredness and some vitamin B deficiency could relate to that, as well as vitamin D. I'm gonna go ahead and write that down for you.
make sure that we have a good order. And otherwise, do you have any questions for me or any other concerns?
No,